people think, well, we live in the 21st century. We have all of these hospitals and all this equipment. It's mind-boggling. I'm not trying to make this up. I'm not looking for a sob story. This is true. It knows no boundaries because this is a problem nationwide. It's not just a problem here in Colorado.
Rate of infant mortality, that is the number of babies who die before their first birthday, in the United States, that means that's 23,000 babies that die before their first birthday. What I want for our country is to not tolerate the fact that our children have different rates of survival to their first birthday based on their race and ethnicity. I would like one number. One number for our whole country would be fantastic.
Really, everybody deserves a first birthday.
As Arvian Harper and her 1-year-old daughter Ellis are playing drums on their living room floor, her husband Marcus and 3-year-old son Porter are practicing the alphabet.
His patience with them, I don't know. Like, I feel like you're definitely an amazing husband and a good friend too. But
did you get all that?
You're just a really great father.
They're high school sweethearts, married for 8 years, but together for 15. And the joy their family shares helps them cope with the grief of losing their first daughter.
Now that I know what it is to have a relationship with your kids and from a dad's perspective, to be longing for that, I appreciate what I'm missing more, even more now. That's something I never even told you before today.
You'll never forget that child. They'll always be in your heart. And don't try to forget them.
Sheila Young lives in Aurora, Colorado. Her home is filled with family photos.
That's my husband.
Her husband died from cancer nearly 10 years ago.
My husband was my best friend, my very, very best friend.
She and her husband lost their daughter Streisand when Sheila was 38 weeks pregnant.
We had gone like the week before to pick out her furniture. You know, everybody was just really excited and looking forward to her coming.
I have 3 living children, but I have 4. I have an angel baby.
Naisha Thorne lost her first daughter when she was in her early 20s. Now she works with kindergartners in Commerce City. She attends a breastfeeding support group with her youngest daughter, Joelle. She has 2 older kids, a boy and a girl.
I've told my son about her, and he has a lot of questions. Would Taylor babysit us if she was here? Would she be in high school? So just different things that come to a 9-10-year-old little boy's mind about having an older sibling they've never met.
The Harpers, Sheila, and Naisha never got to bring their daughters home. And while they were all in different places in their lives, Sheila was married. She and her husband had bachelor's degrees, steady jobs, and 2 healthy children already at home. Naisha was single, her pregnancy a surprise, and the Harpers were still pursuing their education and working in retail. But despite these differences, their stories reflect what so many Black families face. Black women are more than twice as likely to experience a late-term fetal loss as a white or Asian woman, and nearly 2 times more likely than a Latino woman, according to the Centers for Disease Control. These same trends that show more losses of unborn Black babies hold true for infant deaths as well. And the infant mortality rate is much more closely monitored than the fetal mortality rate. It measures the number of infants born who die before their first birthdays. And it's considered one of the most important indicators of the health of a community or even a nation. In the US, Black infants die at a rate 3 times higher than white infants. And this has been true for decades.
Overall, the rates of infant mortality for the United States have gone down over time, which is a very good thing, and we should celebrate that. The crux of the real remaining problem is that there's such significant disparities in our different populations.
Dr. Lauren Smith has been a pediatrician in Boston for 20 years. She leads a national campaign to reduce infant mortality in communities of color.
So despite the fact we have, some of the best medical care and health care in the world, we have one of the worst infant mortality rates in the world of industrialized Western nations.
In Colorado, the infant mortality rate is considered one of the lowest in the nation. but the disparity between blacks and their white counterparts is among the worst. Black babies die at rates as high or higher than those in about 100 foreign countries. And that includes places like China, Colombia, and even war-torn Libya, according to data from the CIA and World Bank. Dimitra Sariki is concerned about these high rates. She's a midwife, and she runs this small clinic in Colorado Springs.
When I chose my OBGYN, I couldn't find an OBGYN that was like me. There wasn't a black female OBGYN.
Now she works with patients who have limited access to healthcare, including those from rural communities and minorities.
And they also need to see a woman of color who can relate to the problems and struggles that they go through every day.
Sariki wants her patients to do everything they can to give birth to a healthy baby who will survive.
Women never forget their births. They never ever forget, whether it's a loss or a live birth, they never forget their births. It is a footprint in their heart for the rest of their life.
A complicated pregnancy made footprints in her heart. She carried her baby to 11 weeks, but miscarried.
I felt like, this is a life. I am excited, I am happy, and looking forward to all the stages of pregnancy. And then feeling like I was robbed.
When you're carrying a baby, they're a piece of you, they're a part of you. And then when you deliver, like with our son or our daughter, they're still with you, And so I know you felt like she was robbed almost of that.
Robbed of their children. And this happens far too often for black families. About 12 black babies die in Colorado out of every 1,000 born before their first birthday, meaning black families are nearly 2 times more likely to lose their baby than a Latino family, and 3 times more likely than a white family. This is Adora Loftus. She lives in a Denver transitional housing unit with her 2 children, DJ and Darla. Their ages 5 and 6. She's expecting her 3rd child in the spring of 2016. Adora recently lost her job.
I was working construction. I was a prep worker. It's good money. But unfortunately, yes, I was laid off. The stress, like I said, is on. Who's gonna hire somebody who's this far along pregnant for the pay that I was getting, that I'm used to?
Adora has a high-risk pregnancy.
I've had preemie, and I am at risk for another one. So the stress is definitely real.
And she rides the bus for an hour each way to get to Denver Health for prenatal care. Adora worries about an early birth and being able to support her family without a job.
What am I gonna do if this happens or if that happens? And then not only about the baby, about my current situation as far as money, was raped or...
Adora's living situation can affect her health and what happens to her baby.
We know that Black women have higher rates of poverty, experience much more discrimination.
Dr. Susan Wang has spent years studying disparities in infant mortality. She says her research has shown that stressful life experiences, like being fired, having a partner go to jail, struggling to provide meals for your family, all of those kinds of things can make people less healthy. And this is especially apparent with minorities.
What we typically consider to be non-medical reasons do cause biologic disruptions.
A biologic disruption that could endanger a fetus or infant's life. And while public health data show a link between poverty and infant loss for most races, it's not the same for Black families. Black families at all income levels are more likely to lose their babies in the first year. And the same is true for education. Neither a college education nor a stable middle-class job decrease the gap between Blacks and all other races. Kelly Teeter manages the Denver Health Maternal Child Health Program, and she's part of a local effort to tackle this national issue.
Unlike other differences we see in health, other health disparities, mortality, infant mortality, is not explained by education level or income level.
You see that economics doesn't explain it all.
Here's what the state public health data does explain. A middle-income Black family earning $50,000 to $75,000 a year is just as likely to lose their baby as a Black family making less than $15,000 a year. And when compared to a middle-income white family, The Black family earning the same income is 3 times more likely to lose their baby. To look at this another way, in Colorado, a middle-class Black family is nearly 2 times more likely to lose their baby than a white family living below the poverty line.
That is absolutely consistent with national data as well, that even if you take the wealthiest Black woman, her rate of preterm birth is still higher than the poorest white woman.
A Black woman who's been to college could have the same likelihood of having a bad outcome in terms of her pregnancy as, say, a white woman who hasn't finished high school. So the benefits that accrue to education and increased income aren't felt equally by all groups in our country, and we have to understand some of why that is.
So why is it that women who are otherwise achieving in the culture, well-paying job, climbing the career ladder, otherwise seeming to do well in this society, would have such high infant mortality rates?
At Denver Health, Dr. Camille Hoffman thinks she can find the answer in clippings of hair from patients like Adora Loftus.
Our assumption is that African American moms have higher levels of stress, and that may be part of the relationship with preterm birth in that population.
The stress hormone Dr. Hoffman and her team are measuring is called cortisol. Cortisol is released by your adrenal glands when you're confronted with stressful events. It's your flight or fight hormone. Studies have proven that too much cortisol can be toxic. At high levels, it can alter your blood vessels, increasing your risk for heart attack or stroke. Cortisol is also a marker for anxiety, heart disease, and diabetes. Long-term exposure to heightened levels of cortisol can reduce your life expectancy. In pregnant women, the hormone is linked to complications and premature birth.
Using the hair cortisol versus the other measures that I mentioned out of blood or saliva also gives us kind of a chronic or overall picture of a stress status. So when we measure cortisol or other stress hormones in blood and saliva, that can be influenced by a bad morning, an event that happened 5 minutes before you saw that mom in clinic. With hair, you won't capture those same kind of spikes and highs and lows, so you just kind of get an overall baseline cortisol status or stress status. But that gives you more of a reflection of someone's overall life accumulation of stress.
Here's how that works. Every month, our hair grows about 1 centimeter longer, giving researchers like Dr. Hoffman an opportunity to, in effect, look back in time. So as she measures a strand of hair, she can test months of stress building up, sometimes even before her patient became pregnant. Here's what Dr. Hoffman is finding.
African American moms have higher stress hormone levels in both hair and in blood and saliva than white non-Hispanic moms and Hispanic moms.
Stress could help explain the disparity.
I wrote this paper about the effects of stress on pregnancy. I remember it being like, how can you not be stressed? Like, if you're a working pregnant woman, like, how can you not be stressed? But then trying to teach like that connection of like, what are the effects on your baby?
It's the stresses of, am I going to be able to provide for my family? All those things. Am I going to be safe? If I live in this certain community, I might be able to afford it, but are my kids going to be safe when they go to school? Or are we going to be safe in our house? Is somebody going to try to break in on us? Stuff like that.
Are my children going to the right schools? Are they safe? Am I secure in my job? All of those very stressful things build up day after day. But what makes it unique for Black families as opposed to any other race? Even those who are not experiencing poverty.
Back then I was probably upper middle class. Yeah. My kids went to private school. They did all the things that, well-to-do kids are supposed to do. They did ballet, they did music lessons, and they went to camp, and they had a very nice childhood, I think.
But still, Sheila felt stress associated with her race.
Well, they're diseases that African Americans have because, their race. Like, I have high blood pressure and I have diabetes. And you wonder why is this only prevalent in the African American community? I think it's the same issue. It's the stresses of racism.
Studies have demonstrated that maternal report of racism is associated with higher reported rates of stress, inflammation, infection, and preterm birth. And so there's enough literature out there that demonstrates that. And given that prematurity is the leading cause of infant mortality, it just naturally leads into a higher risk of infant death if mothers are perceiving higher rates of racism in their life.
I think about the fact that we have schools right here in Colorado that are offering substandard education to typically kids of color and underserved communities. And we know that the schools are poor, and we know that the education is substandard, and we allow it to be so. That's what institutionalized racism looks like in a system where it's just married in the tradition. It doesn't mean that people are ill-willed. It just means it's a part of an institutionalized system.
Nita Mosby Henry works to improve health outcomes for patients of color at Children's Hospital Colorado. She says that includes understanding a patient's whole life circumstances.
What happens when you live in a community where education is poor? What happens when you're in a food desert or there's no good access to public transportation? What happens when there are safety issues, when you live in high crime areas, or where there are no sidewalks or parks? All of those things will either positively or negatively impact the health of an individual in a community.
If you're Black, studies around the country show that your name may turn employers away from your resume, or lenders might refuse to finance your home.
We can't even go in an interview with our hair nappy. Like, seriously, who's gonna hire me? And being behind the desk of somebody's business, I'm not good enough.
I always feel like I'm being watched. Racism is in the Colorado Springs area. It's definitely here. And it's very profound when you're trying to establish yourself as a professional.
I know racism is taught, but how do you get one generation not to pass that down to the next generation so that everybody's life can be better?
And now, in Dr. Hoffman's study, we're better able to measure the buildup of stress in hair, and it's consistently higher in Black mothers, and it could be a significant factor for parents who experience losses like these.
Christmas Eve, she had noticed that the baby wasn't moving as much as normal.
Mm-hmm. So finally on Christmas Day, I'm like, I feel like something is wrong. Marcus's mom told me, it's fine to go in. It's best to just go get checked.
The day after Christmas, we went in the first thing in the morning, right?
Mm-hmm.
Early in the morning, like 7.
Mm-hmm. And my doctor wasn't there. And so then the doctor on call came in and
Dr. Williams.
Dr. Williams, and she said that my oxygen was really low, my blood pressure was really high, and she was concerned, and she's like, you're very, very sick.
Drove myself to the hospital, and they did the sonogram and the ultrasound, and they told me that's where your baby's heart should be beating.
He wasn't hearing anything, so he thought, well, maybe she's hiding or something, whatever. So then he took me into another room and did a sonogram, I believe it was. He just said, I'm sorry, Mrs. Young, but your baby is dead. He tells me this, and I'm shocked, because I'm like, well, I've been healthy. I've been going to my doctor's appointments. I've been taking care of myself. I didn't understand what had happened. And I don't know, maybe I led a sheltered life, but I had never heard of anybody losing a baby. So it was just very shocking to me, and very, very painful, because I felt like I had let my husband down, and I felt like I had let my kids down too.
Dr. Williams came in and said that we were going to get ready for delivery and that she would need to do a C-section.
So they rushed us into the surgery. I remember them specifically monitoring the baby's vitals throughout the procedure, and I was looking at it as we're going to get through this, because I could hear them, I was making myself aware of what they were saying. You know, they're saying, yeah, the vitals look good, it's still strong, and then they went in. I expected to, you know, hear the baby, but then it was like, I remember, like felt like the weight of the world just suddenly got thrown onto me. Like, well, how am I going to tell you that the baby didn't make it?
She is buried. They have a whole section called Babyland, which blew my mind. But yeah, they have a whole section in the cemetery just for babies.
Me personally, I want to be buried and not cremated, and that's one of the things I regret, because I feel like I couldn't. Provide that for my daughter. Like, I had to settle for.
It's okay. I mean, it's okay. So we had her cremated, and yeah. And I just kept her ashes with my mom.
I have an angel baby. I named her Taylor Jean, and she was born August 21st, 2001. I miss her. I struggle as a single mom, but she's a part of me, so.
We have very important disparities to tackle, and we need to be thinking about it creatively and collectively to be able to have the kind of impact we need.
Intervention strategies are trying to target it. And so the largest national initiative aimed at infant mortality right now is the COIN initiative. So it's the Collaborative Innovation Improvement Network to Reduce Infant Mortality. You know, over 40 states are now involved.
Dr. Lauren Smith is the leader of that national initiative.
Well, I think anytime you face a complex problem, you do run the risk of potentially being so overwhelmed by the scale of it that you just throw up your hands and say, this is too hard, I can't possibly tackle it. So I think just taking the deep breath and saying, I'm going to work with the partners is one of the first things to do.
At the local level, the Community Action Network,
so at the center of our work is the families,
which includes Kelly Teeter from Denver Health and representatives from state and local government, work together to reach this goal.
And the goal is not to just reduce disparities in infant mortality and preterm birth, but actually to eliminate it.
Our babies matter, just like your own children. We all matter. So what are we going to do to support each other?
Other groups include the Nurse Family Partnership, which sends nurses into the homes of low-income, first-time mothers to improve health care. And the March of Dimes offers online parenting support. These groups say eliminating disparities in infant mortality starts with education on prenatal and postpartum care, but also being healthy before ever becoming pregnant. They educate mothers on safe sleep, breastfeeding, and midwifery as part of this national movement. And these organizations want to help address racism on a larger scale, but also help individual women cope with stress and limit social isolation. Others just want to share their stories.
There's something very freeing about telling your story instead of keeping it a secret,
And help support each other.
I actually have a friend who had a son pass from SIDS last year. I tell her don't give up and that nobody understands your pain like you understand your pain.
And to just keep living.
Because she had a C-section and it wasn't a natural birth, the amount of time we had to stay in there.
Yeah, there and then home. I needed to recover, but...
Pain being a constant reminder.
Yeah, and you're recovering from giving birth and you don't have a baby. So it was difficult, and then realizing like you have to go on with your life, go back to work, keep going without your baby. And then I got to the point where I didn't want, and I'm like, there's no way I can experience like this loss again. I'd rather we not have kids than to have to go through this again. I realized like I wanted to be a teacher, and that was what I was going to pursue. And when I went through my schooling and got to my student teaching, there's a little boy in my class, and I hadn't seen Dr. Williams in years, and Dr. Williams was his mom, and so we were so happy to see her, and she said, like, when you're ready, you know, will you let me know when you're ready to have a baby, and I'm here and I'll help you and it'll be fine. And a week later, I found out I was pregnant, and then I was like, so Dr. Williams, remember?
I do.
You do too?
Yeah.
It was another C-section. I would always have to do that. And so that whole process was hard, and I felt like I had such high anxiety, like what's going to happen. But like hearing him cry was like the most amazing thing in the whole world.
It's me or the baby?
Porter. And hearing him cry and seeing all of his fingers and all of his toes, and him looking at me. Gonna play your drum. I'm taking some pictures. We call it. I couldn't ask for anything better.